Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. In this video, I'm going to discuss about an anatomy topic called osteology of hip bone. To define about how we need to identify and understand the osteology of hip bone, there is a difficulty for students in identifying the three fused bones in the hip bone and locating the muscle attachments to it and understanding how the weight transmission happens between the hip bone and the femur. So there is a need for systematic learning with clinical correlation. To ideate this, we need to learn the hip bone by separating ilium, ischium, pubis conceptually. We can conceptually learn this by using a color-coded diagrams and relating the landmarks to the muscle action. And we can also use the pelvic models and clinical case discussions in studying the osteology of hip. To empathize this, pelvic fractures cause severe pain and functional limitation. We can study the hip bone osteology by relating it with the pelvic fracture. And understanding the hip bone is essential for gait analysis, obstetrics, orthopedics, and physiotherapy practice. So, coming to the actual structures of the hip bone, the first major structure is the ilium. So, this ilium is shown in this picture. The color is darkened here. So, this wing-shaped structure is the ilium, which is the largest part of hip bone. It is called as ala or body. The important landmarks in the ilium or the iliac crest. The outer border of this ilium is a iliac crest. And the spine, which is located anteriorly and superiorly to the ilium or anterior superior iliac spine. And the spine, which is located immediately down to the anterior superior iliac spine, is the anterior inferior iliac spine. Similarly, there is a posterior superior iliac spine present and posterior inferior iliac spine present. And there is a iliac fossa lies here and forms the sacroiliac joint. So this articulating surface here forms the articulation between the sacrum and the ilium. So this is how the sacrum is getting and attached with the two hip bones and forms the sacroiliac joint. So this picture shows you the osteology of the hip bone. Here clearly the parts are marked: anterior superior iliac spine, anterior inferior iliac spine, and there is a iliac crest. Posteriorly there is a posterior superior iliac spine and posterior inferior iliac spine. There is a notch present, that is a sciatic notch, and below there is a ischium, and this part is the pubis. There is a tuberosity present in the ilium. Ischium is a ischial tuberosity, and the spine that present in the ischium is the ischial spine. And there is a symphysis pubis that is getting attached with the next side of the hip bone and forms together and forms the symphysis pubis. So ischium forms the posterior inferior part of the hip bone, and the parts of the ischium are body ramus, and important landmarks are the ischial spine. As I told earlier with this picture, this is an important landmark in the ischium. This picture shows you the coloring that forms the ischium. The body of the ischium and ischial tuberosity is there. So this is about the ischium. Now coming to the pubis. Pubis forms the anterior part of the pelvis or the hip bone. So the parts are body, superior ramus and inferior ramus, pubic crest and pubic tubercle. So both the pubis meets in the opposite and forms the pubic symphysis. Here the green color coded structure is called as the pubis, and this pubis is having the superior pubic ramus and the inferior pubic ramus, and this is the body of the pubis. So the both pubis together and forms the pubic symphysis. That's how the pelvic cavity is getting completed. So to understand about what we discussed now with the help of this flowchart, the ilium forms the superior part of the hip bone, ischium developed inferiorly and posteriorly to the ilium, and the pubis forms the anterior part of the hip bone, and the acetabulum forms the socket for the femoral head. Thereby the articulating surface is provided. And obturator foramen development is mainly meant for the passage of the nerves and blood vessels into the pelvic cavity. The organs present inside the pelvic cavity receives the blood flow through the nerves that comes through the passage of the obturator foramen. Hope you all understood about the osteology of the hip bone and its basics clearly. I'll see you in some other video. Thank you.